Okay.
Well, gang, welcome, welcome, welcome. This is the Second Opinion Sports Medicine Podcast. I'm Dr. Dhokal. I'm here with,
Dr. Glass.
yes, sir, in your office. It looks like
Yep. Switched up the view a little just to mix things up, keep you on your toes.
good. Well, hopefully we have no technical difficulties today. Hopefully it goes smoothly. But man, happy Monday to you. How's the week starting off?
Yeah, thank you. Good. Really rainy down here. Yeah, for those listeners not in Southern California, we got a lot more rain than we have in a while the last 2 days. So, yeah, it was exciting. In
Yeah,
California, light drizzle, we get excited, but this was more than normal. So it was good. It made it feel more like winter. We went out last night and got our Christmas tree as a family. My daughter flew into town on Friday, so we're doing we saved up all the holiday type things.
yeah,
So we went out and got our Christmas tree last night, set it up, did the whole kind of holiday evening, and it was
sweet.
nice because it was raining also, so it felt even more wintry.
Yeah, no, that is kind of nice. So your daughter's home for the holidays, I guess.
Yep, we got a month with her, so that's exciting, and yeah,
A month. A month is
yeah,
nice. When's the last time you had a month off?
yeah, right.
Yeah, yeah. I remember being in school and just wanting to, be done with the exam phase, be done with all that portion of it and be working. And then you start working and it's like, a month off, that's like almost unheard of. So that's
Yep.
pretty cool. I hope she's enjoying it.
Yeah, so far so good. So first appointment she had, I think she's only been home 2 days, right to the dentist. So
Oh,
I
man.
filled up a bunch of appointments for her.
Got you. So you booked her
No.
up with things to do, I guess, huh?
Yep. Yeah. You remember that coming home from college, you got to nail off all the
Yeah.
things you don't have, wherever you're at. So,
Well, you're a good dad for booking those things and making it as easy as possible because, you're not really trying to do all that stuff when you're a kid coming back home.
no, she's not thinking that.
No.
So yeah, we got her right to the dentist, and then the next appointment was at 12 o'clock. She had her workouts, so she had to get right on her workouts. Strength coach gave them all things to work on, goals to work on, so they can return ready to go for the season. So it's kind of cool.
Yeah, that's important, right? Because those off seasons, if we're talking about collegiate athletes, whether you're on the quarter or semester system, you might have a month off or a few weeks off. But I mean, you and I know if you take 2 weeks off the gym, it's almost like you're starting several steps back. And if you take a month off, it might be like you're starting from square one. You might get it back quickly, but there is a definite decline quick, and so that's good foresight. It's probably just standard practice, I imagine.
Yeah, I'm sure I mean, they have it dialed in. It's a business, right? They, they, they know their schedule coming up for the season, and they want them returning ready to go, no missed days off. But it was pretty remarkable. This is our first year through it, right? She summertime went in summertime, and they take in body, body mass um,
BMI.
yeah, constantly to see the muscle mass, fat loss, body composition, and her last one was this week, and over since August, or was it August? Forget when we brought her out there, but since they started, so she put on 5 pounds of muscle and lost 4% body fat.
Man,
So
that's
pretty,
amazing.
yeah, pretty cool. So
Yeah.
it's fun for her to see it, and coach is real happy. So a lot of
No,
hard
for sure.
work. So.
Yeah, it's a transitionary time when you're in college. You go from high school athletics where it's, kind of after school type of situation to, like you said, it's a business for some people. Coaches are getting paid and paying their mortgage or their rent and taking care of their families with that income that they make from coaching or some other things. And that revenue from college athletics is a big part of some universities and some colleges. So yeah, it's another level up. And when you're a student athlete and you come in as a freshman at maybe 18, presumably I was a little younger at 17
Mhm.
when I was a freshman, but a lot of growth, right? 17 to 21 or 18 to 22. You can really transform yourself mentally and physically if you have the right educators slash teachers slash coaches or trainers, associated with the teams that can build a program and pragmatically take you through the steps, watch your diet, watch your sleep, all these things. It's pretty awesome to be a part of, to be honest, because I think as a normal college student who's not a student athlete, it's hard to have that discipline while you're juggling being on your own for the first time, perhaps, and also a higher level of coursework.
Yeah, for sure. No, it's all good. Yeah. How's your start of your week?
It's been good, man. Mondays are kind of admin days and home visit days. So it's less in the office. I'm in the office usually Tuesday, Wednesday, Thursday, Friday, and then Saturday, Sunday, Monday, home visits and NFL stuff if that's happening. And so today was pretty good. The day always flies by, man. I feel like I do two or three things and then it's here we are.
Yeah.
It's the evening. I have the Patriots and the Cardinals on in the background. They're playing Monday Night Football tonight. And so, yeah, the week started off good. It's smooth. Really, I was reflecting on we have 2 weeks until, the holidays are upon us, right? So, 2 Fridays from now is like the 23rd, I believe. And then we take a few days off for Christmas and New Year's and just a little recharge for everybody on staff. And then, boom, January hits and we're back at it. So, yeah, I was just kind of reflecting on the time period we have, and it's been a productive start to the week, trying to keep that momentum going through this week and through next week, and kind of finish the year strong. That's the objective and attitude.
Yeah. Well, and you brought something up how the year's ending and going into the next year. And I forgot last week to wish you a happy birthday.
Oh,
And I
thank
wanted
you.
to ask you how that was because I know I called you,
Yeah,
and
thank you for that.
and then we called a couple times
Yeah,
while me and Johnny were together, but I didn't expect you to answer while you were in Vegas. And
yeah,
it was
no, it
late
was
night
good.
for us.
It was fun. We went up. I think I mentioned last week for the Raider Charger game, and got some time with my wife for a couple days. Went to a couple nice dinners. We stayed up late a few nights, and didn't lose money, didn't win money. So Vegas didn't get me, and it was a pretty fun trip. I may have a 24-hour trip out there, partly for work, partly for pleasure. Again, I'm gonna try to get a little relaxation in, but I'm going with um, one of my friends who is going out there for some work stuff. So I might go Friday to Saturday, make the road trip up there again. So yeah, I'm trying to, see patients this week, get paperwork done, check in with all my players. It's getting to the end of the season. We have episode 15 of Second Opinion Sports Medicine Podcast. This one right here, and week 15 of the NFL season is starting after this Monday Night Football game. So, man, it's been kind of flying by for me, at least.
Yeah, no, for sure. Speaking of that, in looking at the injuries, and I know we're going to talk about the injuries, but
Yeah,
um, I I found it interesting. We're getting to that part of the season, right? That now certain injuries are season-ending injuries, right? Because
that's
there's
good.
no way they can come back based on the timelines that we've spoken of, right? So like this week we had a couple ACL injuries, right?
Yeah,
And knowing the length of time if they have to have surgery, there's no way that even with playoffs they can come back. And so it's really sad to see that at a certain part of the season people don't kind of pay attention to that. Like there's critical times when an injury, you still have some chances of playing, and then there's now from here on out they got to be really careful.
yeah. There's the timeline's shortened, right? So
Yep.
the it used to be as soon as January hit, January was playoff time, and now it extends a little bit into mid-January. But I did have somebody say in passing to me today, actually, and I didn't connect it till you said it right now, Dustin, but he said, man, there's been a lot of season-ending injuries lately. And I think it's the same injuries, but just later on in the season. So that 6 to 8 week gauge is now a season-ending injury, like you said. So
Yeah.
yeah, man, that's a good point there. It's not necessarily that they're so much more aggressive, but a high ankle sprain might put you out.
Right, exactly. And that's kind of exactly the way you just said it. It doesn't mean when we read these, and a lot of times we got to remember, we're talking to our audience here, is that we want them to hear what they're reading in the papers or what they're hearing in the, social media. When they're talking about career ending or season ending, doesn't necessarily mean it's a worse injury than it was in week 3. It just means that the timeline is different. So you
Yeah.
put it well.
Yeah, no, that's a good point. There were a lot of bunches of injuries this week that I saw, at least. I mean, it may always be that way, but some weeks certain injuries catch my eye, and I did
What'd you
catch.
see?
Well, there was some concussions. So there was 3 quarterbacks that had concussions this week. I wrote it down here so I didn't forget. But Tyler Huntley, the Ravens quarterback, concussed. Russell Wilson, the Denver Broncos quarterback, also concussed. And Kenny Pickett, the Steelers quarterback, also got a concussion. And so all in different ways. Russell Wilson was scrambling for a first down on a third down. He kind of landed on his head, and then somebody landed on top of him. Um, we've talked about concussions before, and but those were in bunches. There was an unfortunate ACL tear. The Cowboys tackle Terrence Steed, he tore his ACL. Debo Samuels this week had a high ankle sprain. We touched base on high ankle sprains last week or the week before, and so that's one of those where they X-rayed him, Dustin, and they by the end of the day said that it wasn't broken. So speculating on my part, I was like, okay, if it's broken 6 to 8 weeks, his regular season's done. He might not be available till 2, 3 games into the playoffs if it's broken. X-rays were negative. They say they think it's a high ankle sprain. It could be whatever, but they're saying it's a high ankle sprain, and so they're optimistic that he'll return towards the end of the regular season. So that for them is probably a big win. Just that they'll have him back for the most important part of the season, which is the playoff push, assuming they make it.
Yeah, so interesting on that, because like we talked about the last couple of weeks, right? Typically, it's better to break a bone than to have soft tissue
Right.
for because of the blood supply and the nerve, right?
Yep.
But in this case, and this is where sports medicine's kind of a lot of at this phase, right? They're they're thinking, what can we do? Because still, a high ankle sprain is going to take 6 to 8 weeks to fully recover and to
Right.
fully have the strength and everything. But when you're looking at your timeline and you got 3 to 4 weeks to get ready for playoffs, right? They know they can get them pain out of pain. Now at that stage, it's like how strong and stable is it going to be, and how much are you willing to play with this pain?
Yeah.
Whereas earlier on in the season, they might say, no, let's go the 6 to 8 weeks. We have that time. Let's get it strong and stable, get you ready for the playoffs so you're really ready. Whereas now they're just getting you out of pain, and
You're
then they're
all
going to
in.
work on, then they're going to talk to you, and say, hey, this is where you're at. That you're having trouble cutting to the left, or you're having trouble in your back, back pedal, but if we brace it and if we tape it and we lock it up, are you comfortable and confident enough to play on it? So it changes the mindset, because 3 to 4 weeks is still not enough. But now here's the other thing. But if you have a break, you can't control that. It's 6 to 8 weeks of healing, but you
Correct.
can't you can't play on it because it's broken. It's physically broken, whether you wanted to or not, right?
Yeah, it's not a pain
So
thing. You just can't do it.
exactly,
Yeah.
it's structurally damaged. So that's the difference. So it's kind of different, because people that listen to our last couple of podcasts might say, okay, you just changed your tone and said that, oh, it's a high ankle sprain, that's a better scenario. Well, it's a better scenario in this
This
incidence
case.
because of the timeline and what's needed to get to be ready to play. We're not talking about strong or stable or if it's even the right thing to do, but these guys need to make their own decisions. And is it a contract year? Is it not a contract? Is this potentially their last season?
Yeah.
What does it mean if they further damage it? Well, then they have a whole off season to recover. So that's where it differs. So I think it's kind of a cool conversation to have,
No,
in that.
absolutely. There's a lot of implications, for, like you said, whether it's a contract year, whether the quarterback is on a rookie contract, and Next year, they're going to have to pay him more, which means there's less money for free agency and the team might change. People might be motivated. This time of year is the all in time of the year where, okay, earlier in the season, like you said, you might say, we don't want somebody to go in. I could think of a couple people who came off injury in the return, maybe a little bit early. One game back, they were injured, and then they had a setback for several more weeks. Well, at this point in time, if you're able to go, it's an all in situation. If you're scrapping to make the playoffs and you don't make the playoffs, you have 6, 7 months to recuperate and rest. And if you do kind of err on the side of pushing it a little bit and you do get re-injured, at some point in the season, it's a one and done situation for the whole team. And
Right.
so you try to go, most people try to go in the thought process of hopefully I don't get hurt. They're going to do everything to prevent an injury. You might even play within yourself a little bit, which I'm a big believer of. Know your strengths, know your weaknesses, know when the ball's coming to you or when you have to exert yourself 110%. And the other times, take the foot off the gas pedal. That's playing smart. There's a reason why Tom Brady, when he sees himself getting sacked, he goes down. He's not standing up and taking that hit and fighting the tackle.
Right.
There's a reason he's played 20 years, and so I think you can be smart about that. And at this time of year, yeah, you're all in.
Yeah. Yeah. Good stuff. What other injuries, see,
Say that again.
what other injuries
Hmm.
came across your?
Yeah, so there was an interesting one, a finger dislocation for wide receiver Tyler Boyd, Cincinnati Bengals. He caught one pass, went out of the game, didn't return, dislocated finger confirmed after the game. I assume he won't play next week, but I've seen people play off a dislocation the very next week and even the same game. So to be determined there.
Again, it
Another,
all depends on what they're, again, position, right? And which finger, how much does it affect their actual play?
right,
If his contract is dependent on catches and, yardage, then he might think twice because if he can't go out there and, give it his all and make sure with confidence that he can catch on ball, he might not do it.
yeah, yeah. I think both things are true. It For a receiver, obviously your hands are important. So if you only have 10 digits. So if
Mhm.
one of those 10 is messed up, if it's your thumb or your index finger, maybe that's more detrimental than if it's next to your pinky finger or something like that,
Right.
perhaps. But yeah, along the lines of hand injuries, uh, a player by the name of Trey Hendrickson. He broke his wrist. He's also on the Bengals. He broke his wrist in the second half, and he played the fourth quarter with the broken wrist. So they, knew it was not in good shape. I don't know if they took films during the game and allowed him to play. I assume he injured it second half, said it was hurt, left it taped and gloved, continued to play, and they x-rayed it after the game is my assumption on how that would have worked. But have you ever had somebody break something and then you said, yeah, okay, just play it out. We're not worried about it. I would think that you might say, hey, dude, you're done. Come sit down.
Yeah, that's a tough call. Again, there's so many factors that determine that, the location, how much is it going to involve the actual play? Can we protect it? Is it affecting nerve supply? Is it affecting arterial supply? Um, you know, all those kind of things. Yeah, I find it hard to believe that they would knowingly let him go out, once they knew it was fractured. So my guess is that he came into the tent or into the locker room, they tested it, um, felt that okay, this might be fractured. Do you want to take an x-ray? Because if it is, you're out, or do you want to just play with it? Is it that bad? How do you feel? And there might be some kind of conversation because it's not a concussion. There might be more dialogue, I'm not saying that's how it went, but that's kind of how it goes. Or sometimes it's not even spoken, they're not even going to ask the question. They're
Right.
going to test it depending on how much pain's indicated. Then the doctor will look at it and also say, You know what? There's a possibility it's fractured. There's a possibility it's not. Can you grip my hand? What's the capillary refill? How much does the blood flow come back as quick? They'll check all those serious, significant things. And if everything passes, then they might tape it up, wrap it up. Can you play? Can you grip? Can you do this? Okay, go out. We'll x-ray it when you're done. And then in hindsight, oh, they see it was fractured. They said, man, you played with a fracture,
Yeah.
so.
No, that's actually a good point. It's interesting to have your explanation on that. I don't know if it matters to you, but he plays defensive end, and so for me, if it was a wrist, playing defensive end, obviously, if it's your right hand, left hand, maybe you could switch sides, depending on if it's your plant hand, if you're on the outside. If it's your left wrist, maybe you play on the right side, so your right hand's planted and your left arm is not planted. But there's constellations you can make. I think if you're a defensive end versus if you're an offensive lineman and you got to go up to block, that's maybe a little more detrimental. As a defensive end, perhaps you can dictate the contact. And so, I could see a little more of a yellow light, green light situation there than obviously if you were a quarterback or a receiver, defensive back, maybe.
Yeah, well, it just goes to show too, the condition before was a dislocated finger come out after whatever.
Right.
This one's a broken wrist,
Right.
bigger bones, bigger, so, and it's just, but different positions, different needs. So, and different structures too. Finger's a lot more fragile than a wrist, right?
Yeah.
So,
Yeah. And it's dependent on person's pain level and, you know,
correct.
things of that sort. There were a couple more I want to get your opinion on. One was T. Higgins, wide receiver for the Bengals, pulled a hamstring. He didn't finish the game. We've talked about hamstrings before, whether it was with Keenan Allen or whether it was with other athletes this season. It's a common injury in the NFL, especially for those speed guys. And we know that that could be a little tweak, a week or 2 weeks, and you can play with it. Or we know it could be, several months, which, like you said, we're at this time of the year where that could be season ending. It seems as though with him, he'll be back, but he was kind of questionable, tried to go, wasn't able to go. So now maybe there might be a bit of more gap in that return. We'll see.
Yeah. Yeah, I think we see a lot of hamstrings, and you'd wonder, like, why do these guys get so many hamstrings? Why, I don't understand.
Mhm.
Now, you can get the hamstrings from a normal, strain like you would any other muscle on a full-on, dead-on sprint. That's where you hear the, first day of camp, people pulling their hamstrings on the 40-yard
Right.
sprint. In college, I pulled mine both summers, same day on test day, pulled my hammy, and it's
Wow.
just like so. But it's one of those things. I shouldn't be running a 40 anyways, So,
Yeah.
but it's one of those things. That's the typical
Although I'm going to say I do remember a center release that we,
hey,
lineman release that we called that you rumbled, 40, 50 yards,
yeah,
almost into the end zone.
yeah. Give me 10 yards, I'm good. And then if you open it up, then I turn on the afterburners, out of just survival mode.
Hey,
But
man, those things make me smile. Those are some funny times.
yeah, no, just picturing that nowadays, not.
Oh,
But
dude, you were intense though. You were intense, like we're going here. People don't expect that, but nah, you were like line
good.
release, boom.
Good times for sure.
Yeah,
But so on getting back to the hamstrings of this, because you see the receivers going out, DBs they're backpedaling most of the time, they're turning and running, but you don't see them coming up lame on, very often. So
right.
one of the things I think, reason why we see these people pulling hammies is because the relationship between the quad and the hip flexor. We know that if the quad is affected, the hamstring is going to have to work harder. So I
You say
speculated, well,
affected. When you say
what's that?
affected, I didn't mean to interrupt, but I was going to ask you a question that I think maybe some listeners might have. When you say when your quad's affected, do you mean overworked or do you mean weak in relationship to the hamstring?
So I think there's a number of factors, but one of the factors is being hit,
Okay,
contact. So if you get hit enough times in the quad, in the side of the hip, and it's going to shorten down the muscle,
correct.
especially if you're not taking care of it on a regular, right? Because a
Mhm.
lot of times the guys will get hit, day in, day out in the games and practices, they might do a little soft tissue, but they're really, if it's not hurting them or not affecting them, but it's kind of like you can only take so much soft tissue injury, micro injury,
Mhm.
before it starts affecting the whole unit, right? So
Very
that's
interesting.
my speculation on some of these guys because they're big, strong, healthy guys. Um, and when we see a hammy pulled, it's like, man, that shouldn't be happening if everything's functioning right, unless it is straight up injury type, you know.
Yeah.
But I just have a feeling that some of these could be prevented, you know, if we have the thought process of let's take care of the muscles on a regular basis, the quads, the hip flexors. I'm not saying they're all preventable because it's the nature of the sport, but
Sure.
I would speculate that, you know, it'd be interesting to see if there was any kind of research done or correlation, but there's not going to ever be. But
Well,
we
let me
do
put
know
it.
how.
I was going to say, let me put it this way: if I brought you an athlete that I was treating, or a new athlete that came to me, um, and I said, "Hey, Dustin, can you assess this person? Here's their position. Let's say defensive back, and in the past they've had these injuries X, Y, Z. Maybe one of them's a hamstring, and you assess them." I would assume that through that assessment, you could come out the other end of that and say, hey, they seem pretty balanced and they're less predisposed to injury. Or actually, what I found was the hamstring to quad ratio or the hip flexor is overly tight on one side versus the other, whatever the asymmetrical patterns might be, or whatever the assessment might be, that you might be able to say to somebody who hasn't been hurt or isn't in pain, you might be predisposed to an injury perhaps, or you have a higher probability of injury because this isn't totally fine tuned. Is that correct or accurate?
Yeah, for sure. We get those kind of referrals all the time, you know, because people know what we do is, hey, let's do a movement screen, let's do, you know, or orthopedic exams, let's do some kind of screening, and please tell me what you see, you know, especially during combine season.
Right.
I don't know, you know, I work with some agents and they'll send me their combine guys when they're in town to make sure we're keeping them in line, keeping them checked because they understand the importance of all that. So, and also sometimes they're like, hey, we're dealing with these chronic aches and pains. We want to make sure by the time they enter the draft that this isn't even an issue. So when they're talking to teams, so you know we don't even have to bring it up. Can you work it out for us? And then yeah, but yes, you're right on. That is something that we could typically see and predict. That's why the movement screen, you know, is used with the Navy SEALs. You know,
Mhm.
the FMS they use corporations use the FMS. You know, these movement screens that have had a lot of research behind them are done to not only predict and prevent, but also to treat too. So,
Yeah, I think it's if I was to say personally, what are, 3 points that I try to really focus on to make sure that I'm giving good treatment or assessing somebody properly, it would be symmetry, right? Whether, and then a ratio. So symmetry meaning like left to right, are they balanced? A ratio meaning, say, quad to hamstring or bicep to tricep. It's not always 50-50, but things should be in ratio and in balance for that particular joint. So I assess that. Um, I think the soft tissue is a big part of my practice. And then, of course, the chiropractic, and then any other modalities that I bring to that patient. I know you do the same thing. Uh, I guess my point is a lot of times people wait till they are hurting to get something corrected, and that's okay if you're a weekend warrior. You're playing softball on the weekends. You're messing around twice a year. But I think if you're an athlete of any level, aspiring in high school to play in college, aspiring in college to play in the pro level, it would really be something I would strongly encourage. Or if you're a pro athlete and you haven't been hurt yet, to get assessed, like you said, through a movement screening or from a professional that makes it their business to find these little details and point those out so they can be corrected preemptively,
hmm
you know.
yeah, I think that's kind of the shift, that we're going for. And it's interesting you say that, because me and you have talked about that, man. How can we get this to more of a global thing where we're doing proactive type care, right? And it's more for the full well-being of the athlete, right? And get the athletes to kind of buy in and understand. I think it comes with education, right? It was interesting because we've talked about that, and we talked about like, oh man, we just need to get in with some of these teams, some of the owners, maybe the players association, just to kind of, hey, let them know that there are options out there to get people like ourselves to help set up a baseline and a foundation and work through it, right? And
Yep.
be there throughout the careers, right? Versus when you jump from team to team to team, if that's what's going to happen, at least you have one steady constant, right? And have a medical team that can be constant, that's independent. And I think that's huge. Well, it was funny because I was, as you know, at the Amen charity thing this last week, and one what right in front of me was Dick Butkus.
Oh no
So
way.
talk about, yeah, his head. I shouldn't say it like that. This guy is huge. Yeah,
Mhm.
I didn't realize how big he
Right.
really was.
Sure.
But I would not want to be hit by that guy.
Yeah.
But it
Legend.
was pretty cool to have him, just a couple arms lengths away. But anyways, I was talking to somebody in the mental health world,
Mhm.
and we were talking about the NFL, and they were actually approached by, and I couldn't get it out of them because I don't know if they knew enough, but they were telling me that somebody that up in the higher ups with about, I think, 6 or 7 teams that they had association with, they were wanting to start possibly some kind of, they wanted to look into the possibility of doing, being more proactive with the mental health side
Sure.
and with scans and with whatever. And I just went into talking about how important that is and kind of what our ideas were, and I thought, man, that's great to hear that there's somebody, and I don't think they were associated with a team. I don't think it was any NFL. They just knew of they I can't really remember how it was going down, but I just thought, okay, at least somebody out there from that's closer to the leagues is having this thought process. That's awesome. Now they're seeking out people. That's awesome.
Yeah, I think that's super, super important, and not only for the people that are playing at the time, but maybe even more important for the players, the alumni, I'll call them, who don't play in the league anymore. That's who I think about often now that I'm, a decade plus treating professional athletes, is the people who retire, who finish, who leave the field injured, who get cut. These are the people that I wonder how they're doing if they haven't thought about or processed what the next phase of life is going to be, especially those who end abruptly on injury. If you retire, you're like, this is my last year. I'm retiring after 10 years or after some accolades because you set some records. But you could be in your third year and then boom, you're injured and you never see the field again. Well, that wasn't your thought process.
Right.
And a lot of people didn't get to where they're at by having a plan B. You've heard that before, right? Where it's like, I just only had a plan A and I went with that. And I can sympathize with that. And I do have that mentality as well. But, you know, I think you should always have an audible and a plan B just for that 1%, and maybe that's just the lame quarterback mentality of like, you got to always like have a second option, third option, a check down, and just kind of be ready for the unexpected. But that's who I worry about. Getting back to the point is the guys who are still young, whose lives have drastically changed from the pinnacle of what they considered success to now they're out of the league, and they might feel a different type of way, or people might perceive them differently or act differently around them. So I wish there was, like the alumni association checked in with people who are no longer in the league for the first 5 years, or maybe periodically for a long time. That would
Yeah.
be awesome, I think.
I personally, I think it's going that direction,
I hope so, man. I
from
really
little
do.
sprinkles I've heard. So hopefully, yeah,
Yeah.
we'll see.
Um, I hope so. I think that's important. I saw that you went to the gala. You were looking fresh, looking dapper.
Thank
Leanne,
you.
nice. You guys both look, super young and super cleaned up and super sharp. It looked like you had a good night out.
Yeah, for sure. That red carpet, that's always fun to walk on that. And
Yeah,
they had the camera crews there and stuff, and they were interviewing everybody. And me and her bailed around the backside, so we didn't want to get interviewed in front of the camera. So we took our picture when it died down a little. But it was a lot of fun, and she definitely having her there definitely made me look better. That's for sure on that red carpet, man.
right.
So I'm very proud of her and very uh, happy that she was with me. And we had a good time, made a lot of good food. Tana Amon, who's his wife, she wrote the Omni Diet book, and basically that's
Gotcha.
more plant based versus protein, but it's not it's an anti-inflammatory. It's a really brain healthy way of eating. Well,
Mhm.
everything they served was a brain healthy food out of her cookbook. She got some chefs to do that, and it was unbelievable food. And then they obviously with the Amen protocols, no alcohol. We had a bunch of mocktails. So all the bars were set up with all different kinds of mocktails, and it was really good. It was a great night, and they raised a lot of money. We listened to a lot of great stories. Jim Quick, who's the brain guy. I don't know if you have heard him. He was one of the presenters, and Dave Asprey, who's the bulletproof guy, was there. He got up and spoke. A lot of good. I actually um, brought you a book. Dr. Amen gave us some books, and I brought one for you.
Oh,
He
sweet.
gave he Yeah, he gifted us some books. So Leanne got one, so I grabbed it for you. I thought we would get together tonight, but I'll bring it down to you. But it's a great book for healthcare providers. Basically, like we talked about, the end of mental illness, right? We're talking about mental health, not illness. So it's his newest book. I wanted to gift to you and share
I appreciate
with
it.
you. So I'll
I'll,
have that next time we're together. Um, but yeah, it was a great cause. I mean, like I said, they're raising money. The foundation's raising money for those that can't afford to get scanned, because a lot of people speculate that these scans and this healthcare is just for those that can afford it, and that those that have the means or have the availability. And there's so many people that are out there wanting to help others because they've been helped themselves, and it's a game changer. So everybody in the audience had somehow been touched somehow with the help of the clinics and wanted to give back. So we're raising money for those that can't afford it or don't have the means. So it's going to be a game changer. And the things he has coming up, and his platforms to help change the and have a new paradigm shift of mental health is really exciting. So I'm happy to be part of it, and I want to bring you in on it and I want to talk to you about it because
yeah,
it's good stuff.
I'd be honored. That'd be awesome. I think it's, from afar, I think it's awesome what they've been able to do. And you and I both know people who have achieved a level of success that other people, also try to, or might be aspirational to achieve that level of success. And my favorite people are the people that get to those heights and then are also still able to relate to where they came from, or even if they didn't come from there, relate to people who aren't where they're at, and then to
Mhm.
take either their time or their resources or their knowledge and experience and share that with people. I think that's awesome, man. I think that's what we're here on this planet to do. We're here for a little bit of time. Somebody said, basically just making an analogy that we're the only rock in the universe that has life as far as we know it. The rest of the planets are just dead rock rotating around their stars, and we happen to have plants and oceans and humans, and we've evolved into these creatures and beings. And just that's it's a small miracle that we're here today. And if we're not here to affect positive change or help our fellow friend, family member, human, then I mean, I think it's kind of a little selfish and time wasted, if I'm
Mhm.
being frank, to each their
Yeah,
own. That's how I feel.
right, for sure.
Yeah.
Yeah, we only have a small amount of time on this earth, and we're all put on this earth for a purpose, in my opinion. And the sooner we can learn that, the sooner we can start helping people and whatever that is, right? It doesn't have to be something in the healthcare, to help somebody. It's just putting a smile on somebody's face, helping them with the door, helping them, just being a good person, live by the golden rule. My family's always, that's one of our things, is live by the golden rule. You can't go wrong living by the golden rule,
A
you
million
know?
percent. Yeah.
So that's what
That's that's important for sure. And it's worth reflecting on for a moment, especially around the holiday season. I know people get really charitable around the holidays, trying to help out those less fortunate. And it'd be awesome if we did that year round versus just during the holidays, because people need help year round. So that's why I think this program, this fundraiser, anybody who donated, thank you. And it's money well invested, I'll say, because it helps people uh, either learn about where they're at with their mental health or help them have better mental health. And that's the world, right? So
yeah. I did. There was a lot of podcasters at the gala. Lewis
nice.
Howe. I don't know if you know Lewis Howe, and
Mhm.
Stevenson, who's the uh, wrote a couple books. But um, Eamon's people did tell me, because we were talking about the podcast, and they did
Yeah,
tell me they would have no problem sending some of the docs, even maybe Dr. Eamon, if the schedule permits, but to jump on here with us sometime
that'd be
to
awesome.
talk about. Yeah, so I mean, every single doc that I've met there, we'd be honored to have any of them, or
All good knowledge, it's
any of
all
their support, group would be. All the colleagues there are amazing. So I told them, beginning of the year we'll reach out and get that done. So that'll be cool.
yeah, that's really exciting because it's always good to talk to people that are in the field. It's nice to be able to spread the word, spread the knowledge, share their experiences about what they've learned dealing with patients, and like you said, help other people. And look, I'm a sponge too, man. I'm trying to learn every single day. I think every week I try to learn something new, and I would say that I could benefit from stuff too. Just from being a doctor and being one of a big family and having a lot of patients and living in 2022, even though we're in the 1% more privileged, there is a lot of stress that comes with it. And so it'd be great to learn some tips, tactics, uh, learn some new things, and heed some advice, for sure.
Yeah, for sure. Constant learning. So let's talk a little more about a couple of these cases.
I do have one in particular, if because I know we were talking about rib injuries last week and the week before. Speaking of a quarterback in particular with a throwing motion, Aaron Rodgers had an injury. This last week, we had another quarterback who had an injury, Mike White. And I think you mentioned that you might have seen some of the Jets game. Did you catch that injury at all?
I didn't, unfortunately. I mean, I've never I never want to see these injuries. I didn't see that one. Um, One thing that started getting my wheels turning, because it was one of the first games of the winter that we're starting to see the weather change. I mean,
Yeah,
it was freezing out there, it was raining. So I started to think, man, I want to do a deep dive and see what the injury rates are with weather and I would assume that the injury rates are higher, but it could be wrong, right? It's just like rugby. You would think the injury rates would be higher in rugby than football,
yeah,
but the actual results are that, typically there's less head injuries in rugby,
in
you know.
rugby. Interesting.
Yeah. So it's one of those weird, so dynamics that I would assume that there'd be more cold weather injuries, more weather related type things, but I don't know. So I'd like to look into that.
I'm sure that somebody with the NFL has those statistics, because then the weather only comes to play if it's not a domed stadium, right? If it's
Right.
an outdoor stadium, or if it's like SoFi, a domed stadium that's open. So there's some elements, or the ambient air temperature is kind of the temperature inside, maybe a little warmer. But for the most part, if you're in Buffalo and if they had a dome stadium like the Rams used to have in St. Louis, weather's not an issue, right? But
Right.
as we know, they moved a game from Buffalo to Detroit a couple of weeks ago because there was like 6 feet of snow
Yeah.
in
That's
one day
crazy.
or something. that doesn't even sound really possible, but
No,
I don't want to live to
yeah,
be
those,
through that. That sounds miserable to me.
yeah, I saw those pictures. It was, it looked fake. It looked,
Let me ask you a question. Don't lie either. I'm going to ask you a real question. Ready?
okay.
Did you say in the last week, living where you live, did you say to yourself or to anybody else, damn, it's cold today?
Yeah.
You
Oh,
did,
big
didn't
time.
you?
100%. Yeah.
It was like
That's,
60 degrees,
yeah.
59 degrees. What was it?
Yeah. It was 56 actually. That's pretty funny
Good.
you said that. Oh, yeah. That was cold, man. I'm bundled
SoCal's
up.
cold.
Oh,
Yeah,
last night you should have seen my whole family. We were all in beanies and Leanne's in her Uggs and got a big old sweater
that's hilarious.
and all the
It-
kids in beanies and I'm bundled up in a big old flannel.
yeah, I got a thermal on underneath my scrubs. I came home and I just was like, well, I could put on a t-shirt or I'll just, keep on my outdoor gear. And
Yeah,
I have central heat, so it's on for sure. Yeah, it
that's
just made me
funny.
laugh because I said that a
Yeah,
few times too. I was like, damn, it's cold. And then I looked on my car and it was 61 degrees. And I said, surely it's at least 59,
yeah, it's gotta be chilly. Yeah.
Yeah, we're lucky
So
out here. But I'm sure
yeah,
there's stats about that. I'd be curious to see if we could find that information at the end of the season. I would think it would be something like injuries at indoor stadiums versus outdoor stadiums or something, and then break it down month by month, September, October, November, December, and see if the outdoor stadiums in December
yeah,
and January are more than September, October. Just freestyling, that's kind of what I would think.
yeah, yeah, for sure. One thing in that, so you were talking about rib injuries. Um, were
Yeah,
you
with
talking
Mike
about
White.
Mike
Yeah.
Mike White's injury? So I didn't see the injury, but one thing I did read up on, I wanted to follow up on because I don't know if you saw, but he left in an ambulance. So
Wow.
he left the stadium in an ambulance, which is not the normal protocol. Okay, you go they have X-ray there. I'd be surprised if they don't. So you go in the back medical tunnel. They take the X-ray. The X-ray tech's there. They have the full facility there. Get the X-ray within minutes. You see something. So in our conversations over the last couple of weeks, we've talked about rib fractures. I think it was last episode we
Yeah.
talked about rib fractures. So my only speculation, I wanted to do a follow up on it today, but I didn't have time. But my speculation is the only reason you would go to in an ambulance and leave, in my opinion, is that they threw up that X-ray film and saw a collapsed lung.
Yeah.
Okay,
Speculate.
and he was having trouble breathing.
Mhm.
So those are all the only speculations I can think of that would warrant jump in the ambulance. Let's get you to the hospital right away. We need to do more tests from a rib injury,
Sure.
unless there's something else they're not telling us. So, what are your thoughts on that? Why else would? Is there any other reason you would think?
No, because like you said, they have so much medical personnel, right? You have the head athletic trainer, assistant athletic trainers, they have orthopedics there, they have outside medical personnel. And I know from was the game in New York?
The game was, I think it was Buffalo.
Okay. I can't speak on Buffalo, although I've been there and been in their locker room, but I know at the Jets home field, they have the facilities there. I'm almost certain Buffalo does as well. And so, yeah, to your point, if they're going to throw him in an ambulance and take him to the hospital, it's for precaution or because they anticipate maybe something could be more serious. And that's the only thing I could think of with the rib injuries. Maybe trouble breathing if something didn't show up on imaging. Maybe they're like, hey, we're going to take him in and get him a CT scan or an MRI or something as
Yeah.
opposed to the X-ray to see, uh, with further detail perhaps. But did he come back? He flew home with the team, then I assume, right?
Yeah, that's what I wanted to kind of
I
do a
think
deep
that's what I
dive real
read.
quick. Yeah. Yeah. So then obviously his lung was fine. They're
Yeah,
not letting him fly if, we had that one player drive, I think 18 hours to play in that game because
yeah,
he
the
had
hospital safety. Yeah.
yeah,
Mhm.
yeah, because he had a collapsed lung. So we know that's an issue. But yeah, so I thought that was kind of an interesting something to talk about. Another one I found interesting that I wanted to talk to you on the Jets also, which was part of that season-ending conversation we had before. That
Mhm.
was not orthopedically involved, but was the Jets' offensive tackle Max Mitchell. he left with what was determined to be blood clots in his right leg that had gone into his lung. So that's another one you don't hear about or see in the papers very much. Basically, he left was ruled out due to non-related NFL injuries. That's what the official, so
You don't see
you
that
do it.
often.
No, not very often. So you see not like for family leave you'll see, or for personal reasons you'll see, but not for an injury that was non NFL related or non sport related. So
What do you think
they
caused that, Justin?
well, they said that he was had a hereditary condition.
I see.
Um, so I kind of wanted to learn a little more about what hereditary conditions there could be. There's certain um, inherent blood disorders that could cause someone to clot more easily. Autoimmune conditions can do that. Cancers could cause that, where you can get a blood clot. Uh,
Well,
you know,
famously, Chris Bosh of the Miami Heat had to retire because of blood clots, and he was
yeah.
at the pinnacle of his career. And there's an interesting documentary about his whole journey that, if you're into sports medicine or you're a fan of basketball or a fan of his, would be worth watching. I would recommend it. But yeah, it's not. When you say blood clots, the first thing I think of is someone who's older, maybe diabetic, poor circulation. Those are the things that jump to my mind at first. But then you hear if it's a younger population and an athlete, then that's usually something a little bit different.
Yeah, for sure. And the other thing we're seeing a lot more in the last 2 years is COVID related blood clots. So
Mm-hmm.
that's where, my first head went to was that he either had COVID at some point, or, from the vaccines, they were seeing an increased incidence, not even talking about the whole vaccine, wherever side you fall on that. But those are the facts, that
Yeah.
there was a higher incidence of blood clotting during that time. I know personally for me, and we haven't talked much about it, but while I was in the hospital and dealing with my COVID pneumonia, on the back end, I passed a blood clot through my heart, and luckily it dissolved to where it didn't do damage. But it was due to COVID. It had nothing to do with anything else. So it's a scary thing, but I kind of wanted to bring it up, the clotting thing,
Yeah.
because a lot of people, I've had patients come in here. I had one particular that I referred out. She came in here, said she was um, this was a couple years ago. She was basically um, loading some things into the car or into her office or something. I can't remember the exact details, but basically had a mechanism where her calf would get strained, right? And
Mm-hmm.
so I said, okay, it sounds like a calf strain, because she had an incident where she felt it happen and then it was sore. So it sounds basically like a calf strain. So she came in. The first time I did not do soft tissue on it, which is not the norm. Normally we would go right in it. I worked some other areas. There was enough in the history where I said, you know what, we're going to work above and below the area. I'm going to get pressure off, because I forget the actual details, but we did not treat it, or we treated around it, right? Not right on, because there was no palpable area, um, or there's a reason why I didn't. But
Mm-hmm.
anyways, she came in the next week and still had it, and it was now hurting longer periods. And I told her, I said, you know what? That doesn't sound right. I want you to go right now to the ER or the emergency room to get it checked out. They'll do a quick little ultrasound. They'll tell you right there, yes or no. They might tell you your chiro's, crazy. Who cares?
Right.
I'm like, hey, I'd rather be called crazy and I don't know what I'm talking about than having you have an issue. Well, long story short, I get a call the next day that sure enough, she had a deep vein thrombosis,
Oh,
okay, a
wow.
DVT, and not only was it in her leg, but it had already went to her lung. She had 12 clots in her lung.
12?
So, yeah. So basically, they had to do emergency surgery, and basically, the ER doc said, "Whoever told you to get here, they basically saved your life, right?" So I get the call from her. I get the call from her parents, and it's like, and it was just so I've always been, because it presented just like a pulled calf or a
Sure,
calf strain,
sure.
something that we always deal with, but there was a gut, something was different about the,
Yeah.
and looking back at it, so I was glad I didn't treat it the first time, or it wasn't even that we didn't treat it, it was, yeah, I keep going back to that. We did something for it, but not like our norm.
Yeah,
But
no, that
anyways,
makes sense. I think, I paused because I wanted to articulate this correctly for those people who aren't in the medical profession, but there is something really to something doesn't feel right here. And I know
mm,
to the layperson that sounds like very casual or kind of generic, but I don't always have to have the answer, but I always expect myself, or at least hope to know when something isn't right, or when my instinct tells me that it is something's off, right?
yeah,
And so, like, if it doesn't fall into the box, something just feels off. You might not know exactly what that off is, specifically. You might not be able to put a word or a name to it, but enough to where you're like, hey, you know what? This is not an adjustment thing. This is not a soft tissue thing. Something is like, I call it my spider sensor,
yeah,
like something is ringing the alarms and you should go get this checked out. And so
yeah,
that's why I always tell people when they come in, if this isn't the right place for you, I'll do my best to get you in the place that is the right place for you. And so, man, I clap it up to you because
yeah,
sometimes people want to leave feeling better and we want people to leave feeling better.
yeah,
And so, to our detriment, it could be easy to be like, well, let me just work
yeah,
this out, and go through the motions. And nobody could wrong you. Nobody'd be like, hey, you did something wrong, but you caught something
yeah,
that could have saved a life,
yeah,
probably did.
yeah. So yeah, I agree, and I agree with the that sixth sense. Listening to your gut. If you, yeah, one thing take home on that with the blood clot, and that's why I wanted to bring it up, because a lot of times it presents like a calf strain or right, or a cramp, right? So just for our listeners, the biggest difference between how do you know if it's a cramp or it's a clot,
Definitely.
and one of the biggest differences is that a cramp will be sudden onset and goes away quickly. Okay. So it's a sudden hard onset of pain, tightness, but within seconds to a minute, it pretty much it goes
Dissipates.
away. Yeah,
Yeah.
thank you.
Yeah.
Got tongue tied on that one. So it goes away. And then, but the clotting will slowly build up, and it builds up pressure, because remember what's happening is there's a clot, and the circulation, the blood flow cannot get through that, right? And so it builds up pressure like a water balloon, building up. And so what you'll have is a slow, gradual buildup of pressure and pain that lasts for a long time. So if it's longer than minutes, so if you're on hours or days, that's not a cramp. So, and in our world, sometimes, well, if it's a real sudden cramp, you can strain a muscle. So you
Correct.
can have the cramp and then have a residual strain for a couple of days.
Which we see
We've
with
seen
athletes
that
all the time.
all the time. So that's where it was like, man, is it just one of those? And then, that's where my first thought was. And I told her, I said it could be a cramp, like because she came in and she says I cramped him. Oh, because it happened at night. She said it cramped at night, and that's when she was having problems. So I'm like, it could be a cramp, but that'd be pretty violent, and you could have done that. But anyways, the other here's the and so and also the blood clots will get kind of red. They'll get hot. Typically, there might be swelling in one leg.
Yeah.
So yeah, so that's the difference, because that's the side that's building up pressure. So those are kind of some things to think about. You can't really stretch out a blood clot. It doesn't get better when you're stretching, where cramps will. Um, but one of the triggers, which a lot of times you're saying the things that we typically think of for clotting, one
Mhm.
of them surgery, right?
Yeah.
Typically knee surgeries, that's one of our biggest concerns is after knee surgery. That's why we don't let the athletes fly. That's why, they're not going anywhere relatively soon. We got to really make sure for those first couple days to weeks is that there's not any kind of clotting issue. So she had none of those, but what she did have 2 weeks prior, I think, was a breast reduction. She did have surgery.
Surgery. That's right.
So, but it wasn't the normal one that we think about, right?
Mhm.
So that was kind of one of the red flags when I was going down the checklist of, well, it could be possible because you were under, it was a surgery, was affecting your, O2, CO2, blood flow. So,
Yeah. Let,
anyways, wanted
let
to
me ask
talk
you.
about the difference between those.
No, that's important because most people who are active have had some sort of Charlie horse or cramp or a cramp in bed from being dehydrated or at altitude or a night of drinking, whatever the case is. So it's important to make that distinction, and I'm glad that you addressed that because this is one of those times where I just assumed everybody knew, and I'm like, of course, but you know,
Mhm.
I want to make it a point that we explain everything. So that's why sometimes I stop you to have you explain something that might sound elementary. It's like, well, let's just explain that to someone who it might not be elementary too. I did have a question along those lines. So this person had a blood clot. Would they be a good candidate to use PEMF?
So I did do some research on that. Um, Off the top of my
Kind of
head.
knowing what my thought process is, right? Is that, um, if there's congestion or there's a clot there, that using the PEMF technology or the mat, in this case, I use a Beamer unit, that it would help oscillate or jostle and increase the circulation and the movement of that. That at times
Yeah,
can be dangerous, right? If it dislodges a clot and it goes, that can be dangerous as well. So,
yeah. So yeah, because the more dangerous one is the venous flow because it's returning back to the heart and lungs.
mhm.
Arterial flow, yeah, yeah. I'm gonna look into. Let's regroup on that because I have an answer, but because we're on air, we're being
Right.
recorded. I don't want to say something and then have it be imprinted and then somebody not hear if I have to make the correction. So I'm going to
No,
cover
no,
my ass.
that's valid. I'll say that anytime, like anytime that I'm not 100% sure, because I've had people come in on blood pressure medication, I've had people who had poor circulation and pain in their lower extremity, and they have some pitting edema. So there's certain, you uh, people that if I have a little bit of apprehension, then of course we don't use that modality. At all times, you want to be able to make sure that you don't make anything worse and they leave feeling better, And so
Yeah.
if I'm not sure, I don't have any shame in telling somebody, hey, let me do some research on the medications you're taking. I haven't seen this combination before. Let me consult with a couple people, or I've even called the company up and said, do you have any research on this particular demographic of any, contraindications? And so sometimes it's an extra step, but I use it as a learning moment, and we can circle back on this and bring it up. I was just curious if at the top of your head you had an instinct for that.
Yeah, because I've had it a couple times. I know, like with hyperbarics, because I've had, typically we want to get people in as soon as possible, and so I know I've done research on that. Um, and I and I and I know I use PMF and hyperbarics, which both affect circulation, and blood flow in different ways. And I know I've used them right away, on certain things, to help prevent clotting. All
Mhm.
right. Um, because of the circulation,
And that's
um,
effective.
yeah, it's very effective. So it's one of those things that's advisable and used, um, so, but I can't remember what the ruling was if somebody already had a clot.
That's okay. We'll
So,
look it up.
yeah, yeah, I like it. That's how
And
we learn, right? I mean,
I was
and
gonna
it's
say,
not that we don't know it. It's just like to your point, like sometimes we just need to put a pause on something, and most our patients appreciate that, right? They much rather us just, they. My dad always says, "Do what's right, not what's easy," right? the
Yeah.
easy thing would be just to wing it or do something. It's harder to say, you know what, time out, let me just regroup. I'm having a mental block right now, just like normally I can ramble off things, right? But this one is not coming to me right now. So the right thing to do is to give myself a pause and be okay with that.
Yeah, and
So
just as a, I don't want to say like a disclaimer, but the truth is that when we bring up patient cases, it is specific to that patient, right? And when I bring up something, even though somebody might have migraines and you had a patient that I've had migraines, we can talk about that condition. But somebody listening who has migraines might have a whole different type of migraine, so that we're never saying, hey, what we're talking about here is specifically, something that you should do or you should follow this protocol. Always see your local, healthcare practitioner, your general physician. Always seek somebody that you see for medical advice before, changing up a procedure or stopping medication. This is all kind of real life feedback from our patient base and our experiences, which might not reflect specifically to you as an individual, but it's meant
correct.
to be informative, obviously educational. We're trying to teach people who are listening something, but also there's an entertainment value in that we're sharing our stories and sharing real life cases, which, like I said before, it might be specific to that particular client that we had and not a particular person who's listening. So I think that goes without saying, but I guess I said it. So
Yeah, that's
um,
good.
you know, that's where I fall on that. But um, well, besides the rib injury with Mike White and the interesting blood clot situation, did you see anything else unique? There was quite a few things that I don't know. Maybe I was just looking for them, but I saw a few more injuries this week than it seemed like on average.
Yeah, no, those are the two main ones I kind of, or I mean, there was a couple ACLs that we saw, but we've talked on those. So, um, yeah, I didn't. There wasn't anything else that I wanted to make sure we talked about.
Yeah. What about patient cases this week? Anything interesting patient case wise?
I had a couple. I had a recent one. Um, long history. Um, lots of concussions. So that was today. I'm really excited about
Gotcha.
um, working with them on that. And they didn't even come in for that. So it's one of those things they came in for a totally separate orthopedic issue, not even related to their neck or shoulders. It's hip and lower. And but in the history, found out 8 concussions. That's
Yeah.
pretty, and like significant ones, right? Like hospital, like yeah. So we had an opportunity to talk about it, and so I love those cases because it's one of those, meaning because I know I can help improve their life. They're dealing with these things on a regular. I mean, her most recent was 3 weeks ago. And
Oh,
it's like, man, and this goes back 10, 12 years of concussions. And she's still having symptoms from like 4 concussions ago. So it's like, man, I have an opportunity to really help and make some changes through education and through treatment. And I'm excited to um, help with that.
those are
So
special ones, man. I mean, just we spoke on it, having 8 or 9 significant concussions in my lifetime. I really empathize with people who are going through that phase of the acute phase of having a concussion. It displays differently for everybody, as you know, but yeah, that's tough, man. And if people don't know where to go, sometimes the generic answer to that is wait it off. It'll get better in a few weeks or a few months, and people just do what they've normally been doing to the best of their abilities with this impaired issue due to the concussion, and they just wait it out, not knowing, like you and I know, hey, you can do things that can improve your symptoms. And so I really hope that you're able to educate and provide and find, like I said, it's different for everybody. Every one of my concussions something, a different thing was most effective, if that makes
Yeah.
sense, without getting
Hmm.
into the details of it. Um, and so I hope you find that one or two thing for this patient. And I think it's awesome that they came in for something else. And, in your history taking that you found this, because again, not to harp on the point, but that's the difference between just going to someone average and someone who's a little bit above average or significantly above average or great, is that you take the extra step. Somebody came in to, whatever it was, some lower extremity issue. I would venture to guess that the concussions and everything involved with that is more serious of an issue than whatever mechanical thing is going on. So uh,
Yeah,
that's what makes
I
our job
agree.
cool, man.
Yeah, I was reflecting on exactly that, and we can go on and on about cases and stuff, but I was reflecting on that after I sat down after she left, and I was thinking her like there if I did normal, chiropractic 10-minute, exam consultation, which I'm not saying that's wrong. I just choose to do it a little different. But if I don't do what I do in taking a thorough exam, I'm not helping her the way I should. There's a reason she came to me, and I know it was because she was in pain for her hip,
Yeah,
but the fact that and knowing the history that she told me, like there's way more going on than her hip pain.
sure,
So like if I just address the hip, she's going to be going to somebody else in another 6 months because she's dealing with issues. So I'm
sure.
excited because we can change, it could be a game changer for her. So
It's I don't know if you find it to be this way, but I'll say what I was going to speak on, is that sometimes it's challenging because a patient will come in and they're coming in for say a back issue, a neck issue, and through the history you find that maybe they're on a half a dozen medications, maybe their diet's trash, their sleep is trash, or whatever, maybe they have personal stuff going on. And we look at that holistically as a patient. All these things affect you in a physical, mental, and emotional way. And sometimes it seems overwhelming to me at times, where I'm like, gosh, we have a lot of work to do here. And I know that I could probably help you improve multiple areas of your life. Not that we're a therapist and we're trying to psychoanalyze somebody. That's not what I mean. I just mean that, like, for a patient that had gout that I told you about earlier, improving his diet is going to make an impact on his gout, and this person came in saying that he had turf toe. And I was telling you, I said, turf toe, damn, I treated a tight end with turf toe and he was an all pro. Like, what have you been doing? Have you been doing some power squats? Have you been like sprinting, running in the sand? And he goes, nah, none of that. Can you give turf toe like sitting at a desk? And I said, not typically.
yeah.
I wouldn't rule it out, but I don't think that's how it is. So through some lab testing and some imaging, we found out he had gout. And so I think my point was just that sometimes making a dietary recommendation or a lifestyle change can make an impact on what the person initially came for. I guess my question to you is, do you ever feel like there's a lot of work to do here and I need to see this person regularly for like 6 months or a year so we can help this person
Yeah.
totally? Or do you just typically treat people who come in for what they complain about?
Yeah, so I've had a shift in the way I approach things over the last 2 years probably,
Hmm.
but I think I've always done this, but even more, I'm very comfortable in my approach to it. Right when I sit down with patients, I kind of explain to them what we're going to be doing today and explaining what I'm going to be looking at, what I'm going to be looking for. And the words I use is we do things different here. So I set the tone right off the bat. I tell them I look at the whole system. I say, I know you're coming in for XYZ, but I need to look above and below those areas. I need to look at the whole thing. I point to the skeleton. I say there's 300, roughly 300 of those, 600 of those muscles, roughly. Those things move those things. I said I need to look at it all, and then we're also going to look. So I tell them, I said, so if I'm talking to you and asking you about things that don't seem related, you have to understand that it's because they might have an effect on those things,
Sure.
even the nutrition, right? Because if your diet's off, it's going to affect how the muscles contract or relax, how the nerves fire or don't fire. So I need to ask you about those. So, and I tell them it's either systemic, mechanical, or anatomical in nature. So we're going to look at all three. Are you okay with that? Yes. And then I try to have them ask questions. So they're like, well, what about this? I say, well, why do you think this is? And then once they tell me, oh, you know it or you don't, and that leads us into the talk. So I've really worked on setting it up so the expectation is, oh, I'm here not just for a rack 'em and crack 'em. I'm here. He's gonna really, and what we talk about is gonna take a while.
Yeah. No, I think that's
So
interesting. I ask because I genuinely want to know. I don't know. I haven't been in your practice in years and haven't gone through your physical exam, even though we adjust each other. I adjusted you for the first time probably over 20 years ago, and so there's some familiarity there. But yeah, I think it's interesting on how you set that table up
mhm.
because that gives the patient expectation. And to be honest, that's one of the reasons that I love that we're doing this is because anyone who hasn't been to a chiropractor before might have some, you know, some preconceived notions on how that's going to go, right? And so,
Yeah,
to your point, the way that you say it is interesting. I think that's good. It allows people to understand that if you're asking something and they're like, well, I'm talking about my low back, why is he asking about what I eat? they're
hmm,
they kind of get it a little bit, and they might go into the appointment thinking, oh, okay, this isn't your everyday normal kind of treatment.
yeah,
I kind of start out by saying nothing we do today is going to hurt. I'm going to tell you before I do anything adjustment wise, so I'm not going to sneak up on you, but I'm going to do a lot of orthopedic exams. I'm going to do a lot of checking. So I might be moving you around, and you don't have to worry about any of that being a sneak up adjustment. Like I'll tell you before any of that happens. And, you know, yeah, ask any questions if you have them. And, this isn't your 3 minute or 5 minute adjustment. If you're used to going in and getting adjusted, if they've been adjusted before, that's one of the first questions I've asked. Have you been before? And if they haven't, what have you heard? Or if you've had friends that have gone and it's been a 2, 3, 5 minute thing, we're going to spend, 3 times more time than that because we're going to go over your exam. I'm going to explain a few things to you, and I might even give you some things to take home to do over the next week. And then keep it real with me when I see you in a week. If you
yeah,
went 0 for 7, just tell me. I'm not mad at you, but I need to know that because if you went 7 for 7 versus 0 for 7, I would have different expectations. So in my own way, I kind of break it down as well. I guess just letting people know this is not a 2 minute, 5 minute adjustment that we're trying to figure out a little bit more because we have the time.
yeah.
I guess that's it. No judgment on how anybody does it, but I like the time because I don't know. I guess I'm doing more than just adjusting. So
No, I like how you approach that. And tell them, I have a similar first line. I sit down right when I sit down. I thank them for coming. I talk to them, ask them if they found the place okay. But then I go right into, okay, listen, this session's for you. I'm here to help you. So make sure you ask as many questions or concerns that you have. I said, I don't want you leaving here wondering what the heck just happened.
right,
So please interrupt me anytime, ask questions. I'm here to help you. And then the next line is basically when we start the exam, I said, no matter what today, you have complete control over everything we do. I say, so you need to be vocal. Let me know if you don't want to do something. I'm going to tell you first what I want you to do. If you know it's going to bother you, hurt you, or for whatever reason you don't want to do it, I'm okay with that. I make notes about it and then we move on. But the bottom line is everything we do here, you have complete control over.
right.
And it really just puts them, no matter young, old, whatever, versus somebody in, I still have the authority, but I've also given them control to take ownership in their own feelings.
Yeah, you
So,
empower them. I think that's
yeah.
important. What's disappointing to me sometimes is people going to their healthcare provider, whoever that may be, and feeling like they're not heard,
Yeah.
whether it's their dentist or their medical doctor, like, oh, I was rushed or whatever. And so I'd like to think that I always end with, "Do you have any questions?" And um, yeah, just take the time, because sometimes you can hear things that aren't said, or see things that aren't said. Maybe is more appropriately putting,
Yeah.
appropriately.
Well, here's the thing. So any family member you have, anybody that's close to you, anybody that's close to you, and they're going to an appointment that's important to them, right? What's the first thing you ask when they come back? You ask them, "Hey, how'd it go? What'd they tell you?"
Yeah.
Right? And so it's guaranteed. So whoever's sitting in my chair, I know they're going home to a loved one. If they have a husband, a wife,
Such
if
a
they
good
have a
point.
brother or sister, it could be their grandma that takes care of them, that cares so much about them, and they just want their baby to feel better. And then for them to go home and go, "I have no clue. He didn't even ask me anything about me. He just touched my back and then told me to do these stretches." How sad is that? Because then that grandma or that mom or dad who only wants to help their kid out, or their husband or wife, they only want them to feel better, and they're fixers. They want them to get better. And then they're frustrated because their baby's still hurting, right? So I always think of that. I'm like, okay, what's their impression when they leave? When they get home, when they speak to that loved one, friend, relative, whatever, are they going to be able to say that the person that they encountered today made their life better in some way? I
Yeah.
want that.
Yeah, made
So
it.
that's my mission with each person, you know.
Yeah,
So
no, I think that's a good way of looking at it, and it keeps you present. I remind myself several times a week that this is that person's most important appointment of the day, most likely. I'm not being presumptuous that like coming to the
mm,
chiropractor's office is the highlight of people's month. But if you're in pain and you're having success, then maybe it is a highlight of the month or the highlight of the week. But I treat it like it's the most important thing in their day. It's their health. And even if they don't realize it, it's an important part of their day. If not, maybe they have an important meeting or they have some school stuff, some work stuff. I understand that. But my point is, I treat it that way,
yeah.
um, because they're coming in to improve their health, and so I want to be focused on that.
Yeah,
So,
I'm writing a note because I want to make sure we touch upon that next time or another one, because I
mhm.
have a great story about that
Yeah,
from our Palmer days.
right.
So let's make note to regroup on that.
Let's talk about that next week. I'm gonna make a note of it as well. Um, I
Perfect.
do want to
It's
touch
just
on.
a Yeah, it's just a fun little story.
No, it'd be good. These are, I think of a dozen of these things during the week, and I make a note of them in my, either yellow notepad that's never very far, or my yellow notes app on my phone.
Yeah.
Either one. But I like to hear those things too because it sparks some memories, and it's always good for me to hear. So I'll make it a point to ask you about that. Um, I do want to wrap up here in a little bit because I know you have stuff to do today as well.
I
After
gotta get out of here, man. I got my daughter's home. I want to go have dinner with her.
absolutely, and I'm over
No,
here yapping your ear off, taking time for no reason. She's probably going to listen to this next week or the week
yeah,
after and be like, "That's what Dad was in there for."
right.
Man, what a waste of time that was. But I do want to follow up since you made a note to tell me that story next week. We did talk about instilling some new habits since we're doing this on the weekly. Uh, I asked you if you wanted to
I
start.
think we're breaking in and out. I can't hear you. Are you there?
Oh, oh, okay,
Okay.
okay, okay. I got you. So let me speak on mine then. I will say that I did not go 7 for 7. I went 4 for 7 this week, and if you asked me, I would have said I was going to go 7 for 7, but life,
Yeah.
some late nights, some early mornings, some curveballs during the week, and you know, like always, I just adapt to the day. Certain days I wasn't able to convert on my goal, but I also don't beat myself up, and I treat the next day like a new day. And so I went 4 for 7. Were you able to do one this week or not really?
Yeah. So no, I'm proud of you, man. A 4 for 7. That's what I always tell my patients. Try to get 4 for 7, right? Because that's more than half, right?
Oh my
And
God.
so that's awesome. No, and so like I beat myself up. Like I didn't. It's the craziest thing because mine was kind of uh, not a harder. It was a non-physical thing, right? I wanted to write down stuff, right?
Yeah,
And I wanted to write down as easy as it is. I just wanted to recap my day because what I learned and read was just recapping helps fuel for the next, and it's just
sure.
and then you start getting more creative, right? So that's what I want to work. And so, but I would get home, and by the time I walk in the door, I got my girls, I got my wife, I got my dog, my cat. I'm just fully engulfed with them. And then by the time I get some time where I want to just kind of chill, I'm exhausted, and
Yeah,
so I just start scrolling on my tickety talks, and and
yeah,
then just zoning out, and then
yeah,
I'm like, then I right before bed, I'm like, damn, I should do that, but it's the last thing I want to do.
sure.
So, in reflecting on it, I was even driving here today and going, man, I need a new one. I'm just going to come up with a new one. But that's
Yeah,
the absolutely worst thing I can do because I I need to have the discipline. The easy thing would be to just to get a new one, but I need to do what the right thing is, and I just need to figure out. So I need to strengthen my brain muscle and my discipline. So I don't want to give up on it, even though I failed this week.
that's okay. Well,
Yeah,
let
you
me
know what I'm
ask you
saying?
this.
Like,
Let me ask you, I wouldn't say that you failed this week because this is a work in progress. I'd like to go December to December, assuming that we decide to continue to do this podcast at the beginning of next football season. I assume we will. Um, so it's a December to December thing, so it's really like did you go 330 out of 365 situation versus a fail or, so that's not how I look at it. And also, if it's not the most important one thing that you can do for yourself, then change it up. There's no shame in
mhm,
that. But
yeah,
if it is the one of the things that's important to you, just because you didn't do it this week, fuck it, do it next week. You know?
yep, I hear you. I like it.
Yeah. So I'll ask you again next week whether you changed it up or
Yes.
whether you got one or two in, and I'll try to be a little bit better at it. I will leave you with this note. One of the things that I wanted to do, I said I either wanted to take a walk or run, get a little weightlifting in, or use my sauna. I want to do one of those three things every day. Today I went to the gym for a little bit. I had a limited amount of time because I had a lunch appointment, and I didn't get to the gym till a little bit after 11 o'clock, and I had a commute, so I had about 25 minutes. I got in there, knocked out a quick little workout. I'm unhappy to report I'm still weak. I'll tell you when I'm back being strong again. I feel like I'm still weak, so that's a little bit encouraging equal parts and discouraging equal parts.
Mhm.
So, anyways, but I saw a neighbor guy there who's retired-ish, probably in his late 60s, early 70s. He golfs, and he was in there. There might be a few guys who are retired in my community that use the community gym, and I saw three guys that all had white hair. One of them being my neighbor, and or somebody who lives in the complex. And when I was leaving, he saw me and said hello, and I said hello, and his name's Dave, and I went up to him and said, "What's up, Dave? How you doing?" He said, "I'm good." I said, "I'm a little bit embarrassed, man." He goes, "Why?" I said, "Because I showed up after you, and I'm leaving before you, and I'm younger than you." And he started laughing. I started laughing. He goes, "Well, at least you showed up. That's half the battle." And so when I left, I thought to myself, that's a lot of life is just showing up. I didn't have all the time in the world, but I got some time in. And I was also looking at him working out. And this dude's, like I said, in his late 60s, early 70s, he wasn't just pushing light weights, going through the motions, looking around. This guy was like working hard, pushing himself. You can tell when someone's lifting heavy
Mhm.
despite the weight. Are they pushing themselves? And he was like aggressive with it. And I just had the thought of, man, I'm impressed that that guy's older, retired, and he's in the gym in the morning, knocking this out voluntarily. And that's probably why he's still golfing and probably why he's still active. And just like I said last week when I spoke with the gentleman at Thanksgiving who was in his 90s and still running, it was just a little motivating factor. And I'm like, man, I got like 30, 40 years on these guys. They would
Yeah.
love to be in my position. And so even though I was lifting feeling a little weak compared to my strongest days, I have a long runway ahead. If if I can survive the video game of life long enough, right?
Yeah, there you go.
With a
Yep.
little bit of luck and some good fortune, and the good good touch of the man or woman above. Like, hopefully, we're blessed to be here for a long time.
Yes, sir.
Anyways, I wanted to share that with you because I thought of you. I saw that dude lifting, and I was like, man, I hope when I'm a few decades down the road, I'm still consistent with it. But it all starts now. It starts with either starting a new habit or uh, keeping consistent with the good habits,
Yeah.
or heck, sometimes you don't even got to start a new habit. You can just minimize your bad
Right.
habits. So those are all wins to me. And uh, yeah, I wish you well in the week.
Thank you. You too, man.
Yeah. Anything exciting ahead before I let you go?
Nope, just dinner.
Good. Well, I'll let you get home to the fam.
No,
Give
no,
Leanne a hug for me, and
will do.
thanks for your time tonight, my friend. We'll plan on meeting in person next week. We have a couple more episodes before the end of the year. I'm excited for January. We're still putting out episodes weekly, and in January, that'll be the first month we have guests. So I'm excited for that as well, to interview some people and share some stories, tell some jokes. I enjoy talking to you, but it'll
Yeah.
be good to get some people that we know in the mix as well.
Yeah, it'll be good. Yeah.
Uh,
We'll only add to it.
yeah, absolutely. Well, my brother, have a great week, my friend. To our listeners, thank you as always. We appreciate you. We love doing this. It gives me a chance to connect with my friend and talk about things that I love, which is health, athletics, being better, being your best. And I know you're passionate about that as well, Dustin.
Yes, sir.
If you like what we're talking about here, give us a follow. You can subscribe to us on YouTube, listen to us on Spotify or Apple or wherever you listen to your favorite podcasts. This is a Second Opinion Sports Medicine podcast. I'm Dr. Dhokal.
I'm Dr. Glass.
We are signing off for tonight. Be healthy, be safe, everybody. Thank you for the time. And Dustin, look forward to doing this with you again next week.
Looking forward to it, buddy. Have a good one.
Man, you have a great week too. I'll talk to you soon, okay?
Will do. Sounds good.
All right, buddy. Bye.
I know.